Hi, I'm Jennifer Betts. I'm a blog writer with Ohio Marijuana Card, and I'm here today talking with Dr. Thress. He is a medical doctor with Ohio Marijuana Card, and he also has a degree in pharmacy. And we're going to talk today about inflammatory bowel disease. So, Dr. Thress, thank you so much for taking the time to talk to us today. We appreciate you being here.
Thank you.
Let's jump right into it. To get started, what is IBD, inflammatory bowel disease?
Well, inflammatory bowel disease is basically inflammation of the individual's digestive tract, and it can be anywhere from the mouth to the anus. And so it's kind of confusing, though. I mean, you think, all right, inflammation of the mouth or the stomach. I mean, there's ulcers, there's diverticulitis, but those really don't come under the qualification of inflammatory bowel disease. The two that do come under consideration are Crohn's disease and ulcerative colitis. So a lot of people get that confused, and I thought it was kind of confusing too when I looked it up, because I would think that something that has to do with inflammation like diverticulitis or ulcers of the stomach would be considered inflammation, but under that heading and all the information I've been looking at, it's just ulcerative colitis and Crohn's disease. And,
so like diverticulitis or like ulcers of the stomach, those would fall under something else, like probably chronic pain when it comes to for qualifying conditions. Yeah. Okay. Right. But specifically Crohn's and ulcerative colitis, those are the two that kind of qualify under inflammatory bowel disease.
Correct.
Okay. And so what kinds of symptoms accompany diseases like Crohn's and ulcerative colitis?
Well, first of all, ulcerative colitis is what it is. It's ulcers, and it's always in the lower GI tract or the large bowel, whereas Crohn's can be any type of inflammation from like I said, from the mouth to the anus. So it's throughout the entire GI tract. But what was the question you asked me? I forgot.
What kinds of symptoms do people have? Yeah.
Well, I mean, basically GI symptoms, urgency, diarrhea, having to go, feeling like you have to go, stomach cramps, fatigue, decreased appetite, weight loss, fever, anemia, blood in the stool. Those are all kind of symptoms that kind of point towards the inflammatory bowel disease. But in reality, it's diagnosed through a colonoscopy. So a lot of times you'll see people with these type symptoms, and they also there's also inflammatory or irritable bowel syndrome, which a lot of people get confused with inflammatory bowel disease. Whereas inflammatory bowel disease is a pathological where you can see things that are abnormal, whereas irritable bowel syndrome is a functional thing where it's mostly just cramps and diarrhea and constipation that have to do with anxiety and stress. So a lot of people get that confused because we'll see a lot of IBS patients that think they have inflammatory bowel disease.
Okay, so it sounds like either way, though, some pretty debilitating symptoms.
Yes, and the neat thing about it is cannabis can help with all that.
Okay, so cannabis can, like all of the symptoms that you just mentioned, cannabis can be helpful for. Yes,
and it's and there's certain plants or certain types of cannabis work better than other types. So I mean, and I can get into that later on, but I guess you had some other questions.
You know what? These interviews are super relaxed. We're just going to go organically. So, if you wanted to get into, go ahead.
All right. So, some of the treatments for inflammatory bowel disease, other than cannabis, there's a lot of biologics out there like Humira, Remicade, and some other ones that they're called TNF blockers, and basically tumor necrosis factor blockers. And the way they work is they affect the immune system and they stop the inflammation that way. And what that does is it sets up the patient for all kinds of infections. They're at risk for tuberculosis, fungal infections, all types of infections, anything with a weak immune system. The other problem with those medicines is they also have increased chances of certain types of cancer. And you know, and if you read all the side effects of some of these medicines, it'll make you kind of look twice about actually using the medicines.
Sure. I imagine that, you know, anytime that you can use something naturally that has kind of limited side effects, it's going to be better than using something that actually kind of changes your body chemistry chemically. So,
Yes, you know,
yeah.
and I always tell patients, you know, you got to watch out for cannabis. It's got some pretty nasty side effects. It might make you happy, so watch out for that one. And but no, the other thing is, all right, so the diarrhea, the appetite, the abdominal pain, the nausea, those are all can be treated with cannabis. It also helps with a lot of patients have insomnia and the cramping and the pain, and cannabis helps with that too. So, I mean, I always tell patients that THC is kind of it helps with the diarrhea, and CBD kind of helps with the constipation. And how the cannabis works is it brings balance into your system. There's CB1, CB2 receptors throughout the intestines, and and THC is really affects the CB1, and CB2 receptors are the CBD. It affects those. So what it does is it kind of brings balance back into the into the GI tract, and there's a lot of anti-inflammatory aspects, antioxidants. It just does a lot of things that help bring it back to normal.
Sure.
And I usually tell patients, all right, for the nausea, you need a little bit more THC, like 20 milligrams versus the appetite, which would be only 2 milligrams. And I think I usually tell people to use both THC and CBD. And because number one, CBD is great for pain, inflammation. It also blocks the impairment effect of the THC. So you don't get impaired if you have like a 1-to-1 or a 2-to-1 CBD to THC ratio.
Yeah, that's something I was going to actually ask about, because like 20 milligrams of THC sounds like an awful lot.
It is. It is. And but sometimes you have to hit it hard. Sure. And so that's why I like to take to help patients to use it on a regular basis instead of wait until it gets worse, because it's usually easier to prevent a flare-up than to treat a flare-up. It's kind of like migraines too.
Yeah.
So anyways.
And so are you able then to help patients kind of, find the right products and the right balance of like CBD to THC and maybe even certain kinds of, specific terpenes to look for that are dominant in specific strains? You're able to help them kind of figure that process out as well?
I can give them information about that, and then they can ask the dispensaries about it. But the big one is caryophyllene, which is the same stuff in black pepper. It's one of those terpenes, beta caryophyllene, and it's in a lot of the certain types of cannabises, like the cookies. That's a really that has a lot of caryophyllene. And then the other one is myrcene and CBG, and that CBG is another cannabinoid, endocannabinoid, and they found out that CBG has a lot of it helps a lot of the digestive issues, along with the CBD and the THC. So you push them towards something that has a high terpene, myrcene and caryophyllene, and by doing that, they'll get better results. And like I said before, I always like to kind of balance out the CBD and the THC, because too much THC might make you paranoid. It also can have some mood altering effects and impair you. So I like the combination. And the other thing is I like tinctures better than edibles. Sometimes edibles can cause inflammation in the GI tract. So if you're going to use an edible, I usually recommend lozenges, where you basically treat them like a tincture, and you use it and you suck on it, and it gets into your bloodstream, those big vessels in your mouth, versus going through the GI tract, because a lot of the medicine gets chewed up by the liver anyways from the edibles. So you're kind of wasting money because about half of the medicine is destroyed by the liver before it even gets in your bloodstream. Whereas with the tinctures, you put it under your tongue, it gets into your bloodstream with those big vessels in your mouth, and it avoids going through the GI tract. So it's a little more effective. You get more bang for the buck, and edibles are twice as expensive as the tinctures. So I kind of push them towards the tinctures, if anything.
Yeah, no, that's great. And with tinctures too, and I know, so putting a tincture though in like your smoothie in the morning, that's basically the same as using it as an edible, right?
That's an edible. Okay. So I have to explain that to patients, and I mean, you can use some of the honey is probably the best deal if you're going to use an edible, because you can kind of put it under your tongue, and it's the cheapest edible out there. If you're going to buy any edible, use the honey.
Use the honey. Okay, well, that's good advice. And besides like edibles potentially causing a little bit of, GI inflammation and, too much THC potentially affecting your mood and causing impairment, are there any other, medical downsides to using medical marijuana for treatment?
Well, I haven't really found out too many. It's never killed anybody. It doesn't cause cancer. All the side effects from the biologics, it doesn't do any of those things. Obviously, if you overdose on THC, you're going to get paranoid and have maybe a panic attack. So, I tell people, if that happens, close your eyes and try to fall asleep, or get some lemon zest or something like that. Or plus CBD will kind of counteract it a little bit. So.
And know that it'll be over eventually.
Yeah, usually most of those things, you close your eyes, take a nap, wake up, and you'll feel a lot better. Yeah. The worst thing to do is go to the emergency room.
Yeah, it seems like that might exacerbate some problems.
Yes, it will.
So what kind of advice do you have for people who might be considering using medical marijuana to treat their inflammatory bowel disease? But, maybe they're a little bit nervous about, the actual benefits, or, just, concerned about whether or not they're even going to be qualifying. What kind of advice do you have for people who are a little hesitant?
Well, I mean, knowledge is the most important thing. I mean, if you understand how the medicine works, what kinds that there are and things like that, you'll feel more comfortable when you go into the dispensary. But a lot of patients, they don't want to vaporize it. We don't advocate smoking because number one, it smells bad. Number two, you get a lot of nasty chemicals in your body. So a lot of the older people people who've never smoked cigarettes don't want to do any vaping. So that's why I turned to the tinctures as a primary source. A lot of people, like I said, a lot of people go to the edibles because it's kind of an easy thing, but when you tell them all about the the liver and the other things, and sometimes it can take up to 2 hours to feel the effects if you have food in your stomach, whereas with tinctures you feel it within a half an hour. So I mean, I think knowledge is the most important thing to give to these patients. That way they don't feel so they don't want to get. I don't like the word high. Because to me, high, if I take away your anxiety, your pain, and your depression, and you feel great, to me, that's high. But impaired means you can't walk, talk, or chew gum. And so when they say this is the stuff that gets you high, I always say to myself, well, who wouldn't want to be high? I just don't want to be impaired.
Right.
So there's a big difference, and we can talk about the CBD kind of blocking that impairment, and give them that information. That way they don't feel so anti-cannabis, and just explaining to them there's different ways to get it in. They even have patches too, and the patches, they're great too. They deliver like a low dose of THC for up to 3 days sometimes, and that's good for chronic pain too.
Yeah, that's good to know. So basically, addressing the concerns for people who are hesitant because they don't want to get impaired. That's pretty easy to do. There are lots of products out there that can help you, not be impaired while using medical marijuana. And basically, it's always worth giving it a try, right? So,
yeah, a lot of patients, they'll try their friend's gummy or something like that. And that's why I see, or they'll go out to California or Colorado and say that's the best they've ever slept in 10 years or something like that. The other thing it's not just about the cannabis either. It's about the foods that we eat too. And in medical school, we were not really taught much about nutrition. And so most of the stuff I know about nutrition is after medical school and doing research and things like that. And it's kind of crazy, but the GI doctors really don't know much about nutrition either. So
seems counterintuitive.
It's scary. Yeah, and when food is really medicine. And so I tell patients to stay away from the worst thing you can put in your body is sugar. It's very irritating. It feeds the bad bacteria versus the good bacteria. Your entire GI tract is lined with bacteria. Your whole body, you have bacteria on your body, you have it inside your GI tract. You have 10 times more bacteria on your body versus cells. So the bacteria are very important. And so if we're feeding the bad bacteria and killing the good bacteria, it causes a lot of inflammation, and it's like a cheesecloth. It causes what we call leaky gut syndrome, and allows large molecules to get into your bloodstream. And unfortunately, some of these large molecules are related to certain foods like tomatoes or whatever, or something like that. And then your body attacks it, and you become allergic to that food. And the other problem is a lot of these vegetables or molecules are identical to some of our tissue, like the thyroid or something like that. And so your body starts attacking your immune system starts attacking your body, and that's what they call autoimmune diseases. So anything that disrupts the microbiome, which is the bacteria in your GI tract, can set you up for a lot of autoimmune diseases. And diabetes, MS, rheumatoid arthritis, Crohn's, these are all kind of autoimmune inflammatory diseases. And unfortunately, we're still eating lots of foods that have Roundup on, which kills all the bacteria in your GI tract, which increases your chances of all these problems. Other than sugar, vegetable oils, trans fats, refined carbs, alcohol, processed meats, all those things cause inflammation of the GI tract. And, so they go, well, I can't eat anything. And I'm like, well, let's see here. You can eat like turmeric, cherries, grapes, berries, the fatty fishes are good with omega-3, like the small ones. You want the small ones because the large ones have mercury, like sardines, broccoli, avocado, green tea, peppers, mushrooms. Mushrooms are really good for the GI tract. They're kind of like a filtering system, and they work with the bacteria to kind of stop the leaking. And so there's a lot of things you can eat. And I've been fascinated with the food industry and how we're being poisoned by our food industry. And the government doesn't seem to care. Because you can kind of look back at all of our, obesity, diabetes is on the rise, autoimmune diseases are all on the rise, and it all has to do with our food industry. And so we're kind of facing a lot of toxins in this world, and and I think cannabis, along with the thought of using more plant-like medicines, is going to turn this thing around, because the drug companies, they don't like dead people or healthy people. They only like sick people. So if we can keep the agricultural industry keeps us sick, so the drug companies can treat the symptoms. And you don't want to cure anybody, because that's a horrible business model. If I cure you, then you will not be taking my medicine anymore. So it's by doing all this and starting, this different specialty, I look back and it's just amazing how we've been taught the wrong things throughout our medical career.
Wow, that's heavy. That's a lot.
I know. So, but
I thought we were just going to talk about marijuana today.
well, it's
No,
all
no.
it's all interacted, and that's
Yeah,
the other
yeah,
thing is
absolutely.
that's the other thing is in Western medicine, everything's broken up into pieces instead of looking at the whole body.
Sure.
What they do is they oh, you'll have to see a GI doctor. Oh, you'll have to see a psychiatrist. And we're finding out that the GI tract really tells the brain what to do. We always thought the brain told the GI tract what to do. So if you're messed up in the GI tract, there's a really good there's a good chance that you're going to have anxiety and depression. So we need to fix the GI tract so we can fix the brain too. So it's,
yeah, absolutely. That makes perfect sense. In my opinion,
and 70% of the immune system is in the GI tract. So
wow.
If you have an unhealthy GI tract, which is probably half the country, that's going to mess up your immune system. And obesity, like fat cells, they're the most inflammatory thing. That big belly, that's just a big source of inflammation.
Sure.
And along with inflammation, and cancer is considered a type of an inflammatory response too. Because if you think about it, your body made the cancer, so your body should be able to kill the cancer. And so I know CBD has some anti-cancer properties. It decreases the blood flow and stops the metastasis. And a lot of other plants out there do help with the killing the cancer too, or preventing the cancer from forming. Because in reality, cancer has probably been in your body for 10 years before it even shows up. And so we've got cancer cells all the time. It's just our immune systems, they're the ones that are trying to, eradicate that. And so it all stems in the GI tract. So I know I kind of went off on a tangent there about inflammatory bowel disease.
It's very informative though.
But yeah, so I don't know. If you look at inflammatory bowel disease, it really does set you up for a lot of different things too. Like you have an increased chance of colon cancer, arthritis. If you ask every patient who has IBD, they all have arthritis, because it's like that's another form of autoimmune diseases when you start attacking your joints and things like that. Sure. Bowel obstructions, malnutrition. The other problem with our food industry is, a banana, like 20 years ago, it doesn't have the same nutritional qualities as a banana today. You need like 3 bananas versus 1 banana. And so all of our soil has been destroyed by a lot of the farming techniques, and we're not getting the nutrition. So a lot of people with inflammatory bowel disease are malnourished. They're set up for a perforation. So a lot of them have surgery too. And so they have to, remove the parts that are destroyed or necrotic or perforated. So a lot of these people end up with several surgeries, which sets them up for abdominal pain and adhesions. So it's just one of those things where we don't really have a cure for inflammatory bowel disease, but we do have. I do see a lot of patients after they've been using the cannabis, they don't have flare-ups after using it for a while. They sleep better. Because if you think about it, if you're a lot of patients are in that fight or flight mode 90% of their life, and in reality, we should be in the rest, relax, and digest mode 90%, and just use the fight or flight. In the old days, like if you were in trouble, you had to run from that saber-toothed tiger. All your blood would leave your GI tract and goes to your arms and legs. So if you're always under that threat of, attack, then most of the blood flow is shifted away from your GI tract. So when you do eat, number one, you don't feel like eating, but you say, all right, I'll try to eat something. And then what happens is it doesn't get digested because the blood flow to the GI tract is diminished. So that's the reason why people have GI when they're anxious. That's why they have the irritable bowel and inflammatory bowel and all kinds of GI issues, because the decrease in blood flow. So
basically cannabis, in addition to helping kind of reduce the inflammation, just like directly, it also kind of inadvertently helps because you are getting better sleep, you're less anxious and, kind of out of that fight or flight mode. And I imagine too, just when you're more relaxed, you have kind of that mental space to make those adjustments to your lifestyle and your diet that would encourage a better, healthier digestive system as well. So.
Yeah, it all starts in the gut. I mean, really, it does. I mean, almost all of our problems, revolve around our GI tract. So, I mean, I know a lot of GI doctors, and basically, I look at them as technicians almost, because they do a lot of colonoscopies and pretty much just talk about different types of problems with it, but they don't get into the other part, like the mental part and the other issues that go along with the GI tract. They kind of push those off on a nutritionist or somebody else.
Yeah. Wow. Well, Dr. Thress, I really appreciate you taking the time to talk to me today and sharing this wealth of information. This was probably one of the most informative interviews I've done when it comes to, really helping people understand, the symptoms related to IBD and how they can be kind of proactive in taking control of their treatment. I always tell patients they're in charge of their own health. Mm-hmm.
And the way our system is set up is it takes the power away from the patient, and it puts it in like the doctor's hands and things like that. So what we need to do is take control of our health. You're in charge of, I always tell you, you're in charge of the doses, the types, and all that stuff. And it kind of scares the older people because they get confused. But I think a lot of people are embracing it. They want to get healthy. They've seen how food can affect their mood, and I mean, just eating that cake can make your arms and your hands sore the next day. And it's like, wow, what did I do wrong there? Yeah. So it's important that we start looking at our health and start taking control of it.
Yeah, absolutely. And so medical marijuana is one of those ways that a lot of people are starting to kind of embrace taking control of their treatment plan and their own personal health, and, diet too. Those are, they go hand in hand.
Well, unfortunately, a lot of times we see patients after they've tried everything. We're like the end of the road for them.
Sure.
And I think we should probably offer a lot of this stuff before that, and they would get better results. But we see the patients that have tried everything. They've been on 3 different meds, and they've all, they worked at first, but then they quit working. Yeah. And so they build up a tolerance to it, which is very common medicine. And the neat thing about cannabis is it's hard to build up a tolerance because there's different varieties of the plant. Sure. So if you do get a little tolerant with one, you can use a different one, a different indica, or something with a little different terpene profile, and you'll get better results. So it's kind of I always tell patients to alternate and change different strands. That way they don't get that tolerance as much.
Yeah, that makes a lot of sense. Thanks you again for the advice. It was very helpful and informative. And hopefully, patients, are patients, I don't know, are patients able to actually request you when they make an appointment with Ohio Marijuana Card?
You'll have to ask my boss about that.
Okay. All right. That might be the case. If it is possible, you would have to call probably to make your appointment instead of doing it online. But if you are suffering from chronic pain, irritable bowel disease, Ohio has actually 22 different conditions that qualify for medical marijuana. Visit us at ohiomarijuana.card.com. Let me repeat that, ohiomarijuanacard.com, and schedule an appointment to talk to one of our doctors. You get a full refund if you don't actually qualify for medical marijuana, but it would be helpful to at least kind of understand the benefits and things that you can do to improve your health naturally and take control of your treatment plan. Thanks for watching, everyone, and we'll see you next time.